morning, everyone. My name is Deepti Jain, and thank you again for taking out time today and joining our session here with University of Louisville School of Public Health and Information Sciences. We will go through a quick introduction and we'll start with the presentation. So, as I said, my name is Deepti Jain, and I'm the Senior Admissions Coordinator here at the School of Public Health. And we are here today to talk about public health program, graduate opportunities, what kind of programs we offer, what are the requirements, and we will hear from our experts, our faculty members as well. So let's start with the presentation. Just a sec. Please let me know if you can see my screen.
Deepti, this is Dr. Bewley. I see your screen, but my video is not working. I'm going to log off and log back on.
Okay. Great. Okay, so a little bit about University of Louisville, where we are. I'm sure most of you must be aware of University of Louisville. It's not far away from Center College. If you drive, I would say, northwest of Danville, you will arrive Louisville in 1.5 hours. So University of Louisville is a public university founded in 1798. And the original School of Public Health at the University of Louisville was opened from 1919 to 1923, so making it one of the nation's first public health school. But due to wanting enrollment and not many programs to offer, it was absorbed by the University of Louisville School of Medicine. And later again, they restarted this school. The Health Science Center, which is situated in downtown Louisville, that is the main second campus, I would say, for the University of Louisville, where all the schools related to health sciences, for example, University of Louisville School of Medicine, Nursing, Dentistry, School of Public Health, and the hospital is situated. University of Louisville is also a Research One doctoral university and one of the nation's top producers of student Fulbright Awards. We have also received the gold ratings and have been ranked in the top 100 most sustainable schools on the planet by STARS. UofL is home to over 23,000 students from across the United States and over 80 countries. In last fall 2020, particularly in the School of Public Health, we welcomed 573 students. If you want more information on the school, here is our website link. So you can visit our website and find more information about the school and the university. Moving forward, here are some pictures of the campus. Many of you might have already visited University of Louisville or might have visited the city, but for those who have not seen the campus yet, there's a few pictures that you can relate to. We also have an online interactive map, so you can visit the link mentioned here, or we can share this information later after the presentation, and then you can go through the campus virtually as well. More information about our students, particularly from School of Public Health. So our students are involved in various activities, starting from advocating about public health at the metro level, district level, or working towards data analytics for the state or for the city, working for outreach in public health, and recently COVID tracing, contact tracing, or vaccination help. So all those things that our students have been doing has been a big support for the community. A very big achievement for one of our students recently was she co-edited a book, Economics on COVID-19. You can see the picture here on the top left-hand side corner. And this book is available on Amazon. So if any one of you is interested in reading this book, you can go ahead and buy it on Amazon as well. So these are our list of programs that we offer. We offer the traditional Master of Public Health program with 5 areas of specialization. So you can either specialize in biostats, epidemiology, global health, health policy, health promotion, and behavioral sciences. We also offer a master's degree directly in specialized areas mentioned here. We have certificate programs, we have research, doctoral, PhD degree programs, and we also offer a few online programs as well. Our school is a member of APHA, that is American Public Health Association, as well as our programs are accredited by CEPH, which is again Council of Education for Public Health. We are also ranked by US News, and our health administration program, both online as well as in person, are both accredited by CHEME, which is the Commission on Accreditation of Healthcare Management Education, which we will learn more today by one of our faculty experts. Let's talk a little bit about the graduate employability, because many students want to know, after you finish your degree program here, what will happen? Where all places can you work? So this is a little bit data that I have gathered. We have a long list of alumni and students profile that we can share, or you can also visit our website and look for information. But these are the few picks that my favorites, I would say. So you can see students graduating with a bachelor's degree in public health and working in Washington, DC. You can see Nida Ali. She is a health scientist at the National Center for Disease Control and Prevention, CDC. We have Selma Advik, who is a program and policy analyst at the Wisconsin Department of Health Services. And we have an assistant professor for the Johns Hopkins School of Public Health as well, Dr. Evan E. Connor. If you look at our employability, 63.7% of our students were employed. This data is from 2019. If you look at our enrolled in higher education, 27.5% of our students were enrolled in higher education. We have a non-data for 6.9 students, but the best part I like here is not employed or seeking, 0%. We have a lot of community partnership because public health is all about community, public, and working alongside maybe with the government or non-government organizations. So you will have a lot to connect with here. This is a long list. You can also visit our website, and we will be talking more about this later in our presentation. Likewise, we have a lot of public health research areas, which we will be highlighting in a while, but there is a long list again. You can visit our website and we will be sharing all this information, and you can connect yourself with whichever research area you are interested in. Now, not taking much of your time, I would like to introduce our presenters. We have Dr. Lee W. Bewley. He is the associate professor here and also the director for health management programs. And we have Dr. Ann Wallace, who is associate professor and also the professor for the MPH Global Health Program. So we will start with Dr. Bewley. I will hand it over to him, and he can start with this quick introduction. Thank you so much.
Thank you, Deepti. It's great to be here. I'm currently in Elizabethtown, Kentucky, and I am happy to spend some time. Again, it's been a few years since I've been at Center College. I have a nephew that is, he's a finalist to go there. He's got a figure between William and Mary and Center, and I'm certain that you guys probably have a good idea of where he should go if he makes a prudent decision. I'm Lee Bewley. I'm a native Kentuckian, seventh generation farm here in Elizabethtown, Hardin County area. I am the director of healthcare management programs. My career path has taken me to the Army Medical Department. I served 23 years as a combat health support officer, a health administrator, and then in my final years in service, I developed healthcare leaders, docs, nurses, allied health professionals, administrators in the Army, Navy, Air Force, Coast Guard, and Veterans Health System through a healthcare management program with Baylor University. And so I was able to come home and join the faculty at the University of Louisville. So my experience and background is primarily in health administration, but also a bit of health policy. And we're going to go into a few key details before I turn it over to my colleague, Dr. Wallace. But to sort of cue up this discussion or idea, and we have 15 minutes for my section, 900 seconds. I want to invest about 2 or 3 of those minutes to show you a promotional video that the Association of University Programs of Health Administration provide specifically to provide an orientation and have a litmus test. Are you interested in the field of healthcare management, health administration? Yes or no? And so we often find that this brief video that our Health Administration Education Association has made provides a good basis to get a better sense of the way forward in a career in health administration. So Deepti, could you please share that video with the group? And also the sound. Deepti, I think we need to share the sound and the video too.
Please let me know if you can hear the sound.
We
No,
cannot hear the
can't
sound.
hear anything.
Do you hear it?
No.
We do not hear the.
Okay, I'm so sorry. I don't know. Let me see. Oh, there it is.
Better system, and healthcare administration, health policy is a way to do that.
The healthcare system has improved a lot, but you know yourselves how much it could be better, how much it could work on behalf of everybody. But at the same time, the country's begging for leaders to speak out for what's needed, what's right.
I think that's what makes healthcare so different. You're selling something that nobody wants, right? So how can we make this a pleasant experience for people? How can we do our best in that vulnerable point of time?
I suppose, when you think of healthcare management, it could sound boring. But really, in reality, I think for those of us who discover the field, we realize the enormous potential it holds for making change.
If you don't like change, this is not the place for you. But because of that change, it drives opportunity. The opportunity not only to advance your careers, but also the opportunity to do something that's going to make a difference in society as we take care of people.
So a doctor will see a patient and work one-on-one with them, right? But a healthcare administrator sees an entire population, and they're an important part of the community. So they're in a position to improve health and improve the community like no one else.
Healthcare has a mission generally to improve the lives of patients, and I think that it really gives meaning to your work to know that what you're doing will impact and touch people's lives.
Healthcare administration is so broad. I think that there are a lot of different types of organizations. You can work in a hospital, you can work managed care, you can work in consulting. And so I just think that there are a lot of different avenues or paths that you can take.
I think it's a matter of understanding what you want to do, and I guarantee you will find something in healthcare management to match up and exceed your expectations.
Healthcare administration is not just about a bunch of bean counters. There are a wide variety of opportunities that one could have within healthcare, from IT to marketing to strategy to finance to operations.
One thing that might surprise people about this field is how much room there is for creativity. This is not just a plug and chug kind of science. This is a place where people can come in and they can really innovate.
Whether you're an entrepreneur and want to be part of a high-tech startup, whether you want to work in a hospital itself, whether you want to work in insurance or policy, some people think you need to be brilliant to be successful. You don't. Really, the most important things are values, the ability to listen, the ability to be humble, the ability to connect people.
I think that if you're, especially if you're a person who solves problems and likes to see results, I think that this is a good place for you to start or for you to be.
All right. Well, does that get you fired up to pursue a career in healthcare management or health policy? Yes or no? Only you can answer that question directly, but we want to have a chance of interest. Some of you may have come to this session and you want to be epidemiologist or work in health policy, or maybe be a physician or work in other health areas, or something else, and that's perfectly fine. We wanted to have an opportunity to give you a sense from our areas of where you might pursue those options. And so I'm going to provide just a few brief considerations about the field of healthcare management and policy. A couple of things. One, nearly a fifth of our economy is dedicated to healthcare delivery, logistics, and resources. And so think about all of the different health organizations, hospitals, health systems, group practices, logistics, consulting, health insurance, medical products, all of those health corps, public and private, the VA health system, Department of Health Services, Medicare, Centers for Medicaid Services, Baptist, Norton, St. Elizabeth. Everywhere you look, you're likely that if you have human beings, you have folks that need healthcare or the coordination of those resources. What professional health administrators, healthcare management specialists perform is the planning, organizing, leading, and controlling of healthcare organization elements. And so future state CEOs, directors of hospitals, health systems, potentially, particularly in the looking in a forward 21st century perspective, entrepreneurship, creating solutions to healthcare problems and the coordination of population health management, administration, and then the coordination of policy, either on a consulting basis or working with state, federal, local government to achieve those policy aims. And so there are a number of different areas that you can apply the competencies that you gain in undergraduate or graduate level education. I have to tell you, frankly, that you can enter the field of health administration and health policy with a bachelor's degree and some experience, but ultimately the master practitioner credential, whether or not that's a master's in science and health administration, master's in health administration, MBA, master's in business administration with a focus in healthcare, MPA, a few other degrees, in our field is the master practitioner and expected level of education. So many pathways for folks that work in healthcare management or health policy is they start with a bachelor's degree and either transition directly into a graduate program, or they have orientation and experience for 1, 2, 3, 4 years to be in the field and have that initial level of experience and then transition to graduate level education development. Our field is highly credentialed. All you have to do is look to the left or right and you see that you're working with physicians or nurses or technologists or allied health specialists. Credentialing is important. Are you board certified or not? Yes or no? Do you have the advanced level of education? But that same level of education and development and advanced licensure makes our field a good, great place to work. Anywhere you work, you're going to have a bunch of highly intelligent, highly developed, capable people working in teams to achieve a greater effort. Whether or not it's a for-profit organization or non-for-profit or public, every element or every focus is intended to either improve the life or repair the condition of an individual or a family or a group or a population. And so there's noble purpose in our work, but there's also a group of well-developed, trained, developed people that you will be working with on a regular basis. Now, it's not all peaches and cream. There is stress. You often see people or families in their worst day, whether or not it's an injury or disease or in the middle of a pandemic. But the work, while stressful, is rewarding because you help, you reward. You also have a basis to earn at least average, if not above average income. Because of that nature of the coordination of resources, health administrators facilitate and leverage their standing to enable docs, nurses, allied health professionals, technicians to do their work. And so that basis of allocation, one administrator may serve multiple 10, 20, 30 providers of healthcare. And so you feel a critical role in coordinating those resources. And so as you see in the Bureau of Labor Statistics data from AUPHA, is that the mean income for a health administrator in the United States is about $100,000 a year. Mean, average, so go back to your statistics, there's a normal distribution. So folks starting off might be in the 60, 70,000, and those folks at the higher end could, well, earn as much as anyone in this country can make. Before I run out my time, I've got about 3 or 4 minutes left. There's a couple of things to consider. As I see you're at a fine institution, Centre College is internationally, nationally renowned. You have choices as you go forward and for graduate education and next step. Ensure that if you're considering healthcare management or our health policy, that you would attend either a school of public health, if you're focusing on public health, that is accredited by the Council for Accreditation of Public Health, CEF, for a school. If you're pursuing graduate healthcare management education, consider an institution or a program that's accredited by CAME. That's the Commission on Accreditation of Healthcare Management Education. CAME requires a competency-based approach for curriculums. That is to say that the industry, National Center for Healthcare Leadership, the American College of Healthcare Executives, the Healthcare Leadership Alliance, have established key competencies that graduate healthcare management programs must cover in order to graduate people who are competent and ready to move into leadership and management positions. And so there's a whole line of programs that can be accredited. University of Louisville is one of those programs. University of Kentucky here, also in the state, is CAME accredited. Be sure you find those good housekeeping seal of approvals for accreditation, because so many more doors will be open for administrative fellowships, internship opportunities, or for first employment graduating from a CAME accredited program. And then finally, I'm going to close out. I've got a couple of other perspectives. When you attend, either upon graduation, when you go out into the field of health administration or policy, or while in a graduate program of healthcare management beyond, understand and appreciate the role of professional organizations such as the American College of Healthcare Executives or Medical Group Management Association or Health Financial Management Association. Those professional organizations exist for three primary bases. And so as a member of one of the professional organizations, American College of Healthcare Executives is the premier program of development in our country. ACHE provides a basis for continuing education and development. So when you earn that bachelor's degree, when you earn that master's degree, and you're working out in the field, just as the providers and other healthcare professionals on your team must have continuing education to remain current in terms of all of the elements of their practice, professional organizations such as ACHE provide a basis on an annual and a periodic basis that you stay current with financing, policy, law, practice of health administration. The second component of that continuing education is a network. Being a member of ACHE or a similar professional organization allows you to have people to the left or right that you can ask for referrals. You can share information. You have a built-in group of support and continuing development, and also networking for job hunt, for being able to have best practices or ideas, and be able to enhance the way that you pursue and develop your own career. And then finally, the third element of professional organization is credentialing. With time and through board certification, you can attain the status to where you demonstrate to the field that not only do you have your bachelor's, not only do you have your master's, but you have achieved board certification status by completing a series of service opportunities, completing continuing education development, being interviewed and vouched for by members who are currently board certified, and then finally completing a Board of Governors credentialing exam to join that status. And so there's so much to cover. I appreciate you had a chance to watch the video. I'm going to close out by saying that at the School of Public Health and our Department of Health Management and System Sciences, we often have virtual information sessions for our department, and also virtual sessions. And in our department, we have a doctoral program, multiple master's degree programs, health administration, health data analytics, and health policy. And we also have special focused virtual information sessions for our master's in science and health administration. Without further ado, we'll have some time for questions, but I want to pass the time to my colleague, Dr. Ann Wallace. Go Cards.
Thank you, Dr. Bailey.
All right, do you want me to just start off? Okay, I'm Ann Baber Wallace. We have things in common already. I guess what I'm going to talk about is just so completely different from Dr. Bailey. And this shows the real breadth of public health. So I actually went to Mary Washington College, which is a small liberal arts college, happens to be in Virginia. but not unlike Center College. And that means that I came out with this, classical liberal arts education. And I'm now a reproductive epidemiologist with an emphasis in social and global health. So how does that happen? It happens because when you have the kind of training that you all are getting in the liberal arts, you can take it anywhere. You're getting the basics of excellent understanding of literature, history, political science, economics, languages, and those can all be very nicely turned into a wonderful public health graduate career and career beyond that. I spent, after I did my undergraduate degree in history, I actually studied medieval history at the University of Virginia. And from there, I wound up working in health policy in Washington for a consulting firm for about 10 or 12 years. And I could see where my interests were going. So they were going from this more, really arcane area of medieval European history into work that I found to be really serviceable and practical and on the ground. So I then went and did my master's and PhD at Johns Hopkins in Baltimore, and where I studied first health policy for my master's degree, and then maternal and child health with an emphasis on reproductive epi. So I am actually within the Department of Epidemiology, and within that department, I'm the director of our MPH in global maternal and child health. I started I think I must have been interested in the global world from the time I was a young girl. When I was about 5, we lived in Tehran for about 6 months, which is, it just really changed my whole life. The fact that my parents traveled with us, that when we lived in Tehran, we did not live with the other American expats. We lived in an Iranian part of the city and ate Iranian food and lived as close as we could to a local life that wasn't just, many people who work abroad just bring their American life or their European life along with them. And my parents never did that. So that really set me up. So in the years since, I've been working in Romania since 2006, elsewhere in Eastern Europe, and then India. I took students on 2 study abroad trips to states in South India, and then worked with one of my dissertation students who was very interested in a disease called chikungunya, which is mosquito-borne. And there had been recent outbreaks in Tamil Nadu, which is a state in the very southern part of India. And she really did a community-based intervention that she evaluated. And it was really fascinating. As part of her work, she was very interested in something I'm also interested in, which is how do you determine socioeconomic position when there are really different cultures involved, where it's not just what we traditionally say as education plus income plus employment. It's much deeper and more subtle than that. So she actually developed a 40 question questionnaire, 40 some questions, but it included observations like, is the floor made of dirt or wood or concrete? Is there electricity in the home? Where is the toilet? Is there a toilet? Where do they do their cooking? How many people are living in a certain size of space? And on and on and on. And we found very subtle and interesting differences that were not just bound by caste, although that was part of it. So what else? In more recent years, I have done 2 Fulbrights. One was to Armenia, where we studied women's exposure to carbon monoxide and other particulate matter when they bake bread. And so that was a fascinating study. It turns out that their exposure levels are at the toxic level, making this traditional bread that every woman makes, especially in rural Armenia. But the other piece that we found was that even though they were exposed to these toxic levels, many of them were living, these were well over 70 years old, many of them, and they were amazingly healthy. Like they did not have, we found some statistically significant differences in blood pressure, but the fact that they were alive was just amazing. So my next question is, and what I want to do when I go back is find out like where does their resilience come from? Like not just that they're exposed to poisons when they bake, but why are they doing so well? And to me, that's always such an interesting question. I also did a Fulbright in the Gambia. I was the first ever Fulbright to be in the Gambia. The Gambia is in West Africa. It's a tiny country. And I had actually been teaching there already, and I've taken students there. And I'm also really super proud that I trained the first ever Masters of Public Health and Masters of MS in Public Health. There were 9 of them, the first ever cohort out of the Gambia. And those students some of them are working for the WHO, some of them are working for the Gambian Ministry of Health. One of them got a WHO fellowship to be in London studying for a year. It was the COVID year, unfortunately. They also, a neat follow-up was our CDC went and started training field epidemiologists. And field epidemiology is a whole other like super interesting thing where you learn to do surveillance and detect and track diseases, both communicable and non-communicable in communities. I could talk all day. And now I'm doing work in Nigeria, mainly around maternal mortality, which is one of my passions. My sort of lifelong passion is to address and prevent infant and maternal mortality on a global scale. Right now, about 500,000 women die every year across the world, and that's probably an underestimate. And most of them die in a few of the countries, and those are, of course, the poorest countries, where they're also exposed to malaria, parasites, other infectious diseases, and often just simply cannot reach the care that they need in terms of prenatal care, but also labor and delivery and anything that can follow, which could be bleeding out, hemorrhage, it could be infection and then sepsis and then death, or numerous other things that we don't even see here or in Europe or rarely see. So I think I've probably talked enough, and I'm looking forward to questions. Did I miss anything serious, D? So I can tell you just for a minute about the Global Health Program. So the Global Health MPH, we've been running now for 3 years. We're going into our 4th year of it. So we're really getting it down. You focus on, in your first semester, you take the basic public health courses. So intro to epidemiology, intro to biostatistics, intro to health policy, intro to health behavior, and then environmental health. And within the Global Health MPH program, there's required courses in global maternal and child health, perinatal and reproductive epidemiology, child health and development, survey research, social epidemiology, evaluation research, which is a really interesting topic, sounds boring, super interesting. And then you have a practicum experience. Many of our students have gone, when they can, traveled internationally. We had one student who did her practicum in Croatia, looking at vaccine resistance. Another student went to, I guess 2 students have gone to Nigeria. We've had a student go to Armenia And this semester, this coming summer, we're having students do their practicum online, but by next year, I think, we'll all be back in the field. One of those students will be working in Romania and one in the Gambia. So I've got a really pretty wide network of colleagues, friends, and so forth in the field where you can, so many places that you can do your practicum placement, that students just come back really excited and with even better skills. In other words, they're able to go somewhere and apply the skills that they've learned in class. So, ready for questions.
Thank you so much. We'll go ahead and open the floor for any questions or anything you have. And yes, we can raise hands like that. Thank you, Carolyn.
Hi, so I'm really glad that I heard from you, Anne, especially because your work is especially what I'm more interested in. Not that I was grateful to hear from everyone. That sounded awful. I'm so sorry. What I meant is that, like, so I'm an anthrosoc major and gender studies minor, and so I am I'm really interested in like medical sociology, medical anthropology, and so I'm also involved with our organization on campus, Center Feminist. So this is work I'm really interested in, and so I guess my question for you is like, would it be beneficial for me to pursue public health policy or a similar program for grad school? Because I'm thinking like I definitely plan on going to grad school, but I'm not quite sure where to start with that. So this is a question for everyone.
So those were some of my interests going into life as well. And I do a lot of I call it ethnographically informed research. So it's informed by anthropologic methods. I think it's crucial to getting into the community and figuring out what's going on. And I think that is it's sort of like a long game. You don't just go in and like do a survey. You really want to go in with kind of the mind of an anthropologist and learn as much as you can. I think the beautiful thing about epidemiology and global health to me is that it's so applicable, but it brings in so many different things. Like I think about like the edges or the boundaries of epidemiology as being penetrated by an understanding of history, of anthropological methods, of sociology, of economics, of world politics, world economics. And we have the flexibility and ability to draw from all of those methodologies to do much better epidemiologic work than I think has largely been done in the past. Epidemiology, and there's certain aspects of it that I find a little boring and I find a little bit linear, but we don't do it that way at the U of L, especially, in my classes and my programs. We take a very, very wide view. So I would think that, I'm not going to lie. I'm going to say I think that the global health degree would be great for you, especially, with your interest in feminism. I always draw theory into my coursework, and clearly feminist theory is part of women's health. It can't not be. All sorts of social theories, socioeconomic theories, development, child, human life course development. I've been very interested in, and we teach a lot about understanding why there are Black-white differences in, say, infant mortality and maternal mortality in the US. I've got at least 2, maybe 3, I'm not thinking right now, students working on exactly that right now. And we can look back, is it about epigenetics? Is it about, because there's been hundreds of years of trauma in the Black community that results in actual hardwired physiologic changes that mean that Black women are more likely to die and their babies are more likely to die. Is it that? Is it exposure to racism? And if it is, how do we measure that? How do we learn about it? There's like all these questions, and we need more students to help us find the answers. So that's my plug for my programs.
Thank you so much. I appreciate the information. Thank you.
It's about our discussion. I love Dr. Wallace's description. Her work and her passion she pours into that discipline is inspiring. And so
Thank
the
you.
practical aspects of health administration notwithstanding, I'd love to be one of Ann Wallace's students. So it's okay. If you guys are interested in health administration, I'm happy to guide, but I'm also happy to share that we have a great group of colleagues and great programs that study multi-dimensions of public health and population health management.
Yeah. Thank you, Lou. I just called you Lou. What am I thinking? Lee, I know you better.
It's Lee W. Bewley. It's happened since middle school.
Well, you know, that is what it is, because it kind of flows together. But anyway, I know better.
Okay, my hand's up, so I guess I'll just talk. So this is a question also for Ann. But by the way, you're doing a great job. I mean, both of you guys are doing a great job, like plugging in the programs at U of L, because I didn't know like much about it before this meeting. I was debating studying maternal and child health program. Like I was just looking at different schools, but from your description, it sounds like global health encompasses all of that instead of like extremely narrowing it in. And literally, at first, I wanted to be a midwife because, like you were saying, the high mortality rates for Black women childbirth. And then I was thinking about just women's health. And now I'm thinking public health. But the whole common theme is that I really want to focus on women and children and health, and especially like minority women. So it sounds like the global health program at U of L like encompasses everything without me specifically narrowing in on like just maternal and child health.
Exactly.
Okay.
Exactly.
All right.
Yeah.
And I guess, and then just for clarification for Lee, earlier you said to look at schools with accreditations, and you said a CAMI, and then you said another school, and I forgot which one was for what. I was trying to write it down.
CAMI, CAHME. CAMI accreditation is for graduate programs of health administration. CEPH, CEPH, or Charlie Echo Papa Hotel, Army terms. CEPH is the Council Accreditation for Public Health. That's for public health schools. So there's accreditation for the whole institution, University of Louisville, Center College, Harvard University, UCLA. Then there's schools within universities. CEPH would be an example of specialized accreditation for public health. And then our own program, our single program, master's degree program, is accredited at the programmatic level, and that's CAMI.
Thank you.
So when you're thinking about, can I ask you what other programs in maternal and child health that you've looked at or are thinking about?
The one I saw was at the University of Minnesota, and they also seem to pair it with social work. And I wasn't sure if I wanted to do social work. I don't know. So yeah.
Yeah. So there are other programs. You should look at them. I think a real plus about our School of Public Health as a whole, no matter what department you go into, is that we're small and we punch way above our weight. So, you know, you can go to a school that has a higher listing on the US News and World Report, you know, rankings, but, or you can go to a school where people really are one-on-one with you. Our classes are so small that my biggest graduate class that I've ever taught here was 13 people. And more often than not, they're between 3 and 7. So you get serious individual attention. And then our students, as Lee alluded to, really do go on to, we've got one who's going to be working at the Johns Hopkins, it's called JHPAGO, and it's the Johns Hopkins International Women in Health organization that is international. They're everywhere. They do a lot of work for USAID. That's huge. We've had one go and work for a pharmaceutical company, which is a completely different thing. We've had others finish their PhD and then become postdocs and occasionally professors in our department or other schools. So there's just such a wide range of things that are out there, and what I think we offer that's appealing.
Thank you. And then also thank you, Deepti, for putting those links in the chat.
You're welcome. Any other
I just have more of like a logistical question. I know that some public health schools are requiring the GRE, and I know that I'm a rising senior, so it's kind of time to start thinking about that. And I was just wondering if U of L is thinking about not requiring that or waiving it or requiring it.
Summer, I can speak for our MSHA program. We no longer require standardized tests. It's supplemental information that you can provide, but our review of student success is that institution and undergraduate performance are the primary drivers of student success. It's additional information, but we don't require students to have standardized tests for our MSHA program at this time. There are other, you have letters of recommendation, you have to write a personal statement, but the primary, your institution and your undergraduate performance are the very strong indicators of success at graduate school.
Exactly. So we don't require it in epidemiology or global health anymore either. We found that it's not predictive of student success. And what you really want to focus on in your application, as Lee said, is get very good recommendations from people who really know you and really work on your personal statement. For me, that's one of the first things I go to is the personal statement. Make sure you want it to be perfectly edited, very well written, and also, tell your story about why you're interested in the program. So yeah, we look at the whole picture. I love to see that people have taken a wide range of coursework. Yeah, so no to the GRE for us.
Perfect. Thank you, guys.
To add on to that, most of our master's degree program here at School of Public Health, we do not require GRE or GMAT. Only the Master's in Health Data Analytics is one program where GRE is required. Apart from that, as Dr. Wallace and Dr. Bewley mentioned, for MPH, MS Health Administration, MS Epidemiology, MS Biostats, or other programs, master graduate programs, we do not require GRE.
Come on, more questions.
I have one. Thank you both for being here. This has been really informative for me. I realized recently that I'm more interested in public health, so this came at a great time for me. I was curious that if I know for summer experience and stuff, I'm sort of looking at shadowing different people and I guess sort of trying to find research or anything like that. But I was wondering if there are any specific sort of experiences that you would recommend. I know medical schools might recommend make sure you're interested in this by having a shadowing experience and stuff like that. So I was wondering if there was anything specific general that you guys would recommend before applying.
Do you want to go first, Lee?
Happy to do so. My sense is that if you have opportunities to either have a working internship or to volunteer in any type of healthcare organization, what Dr. Wallace was describing in terms of our admissions process is about fit. If there are a number of people who are qualified that have standing for admission into a graduate program, but we want to make sure that you are best fit into our program and our program is the best fit for you. And so spending some time in a healthcare organization and having a sense of the practice, the requirements, the stresses, the joys, a full immersion to the extent that you can for weeks or a few months, or perhaps while you're still undergrad, if you had a part-time position, is useful. In that same vein that I was describing, that some folks that are as professional health administrators, healthcare management, they graduate from an undergraduate program, they spend 1 or 2 or 3 years in the field to have some experience, earn some income, but yet then transition into graduate programs is a pathway. You can achieve a similar effect through volunteering or internship or part-time work while an undergrad at a health organization.
Yeah, that's a lot of what I would say too. I think there are data that actually show that when you take at least a year off between undergraduate and graduate school, you perform better in graduate school. And that's partly because of an accumulation of life experience. What things I would think of might be Peace Corps, that's 2 years. I would also consider you might want to look at what faculty are doing and what their interests are, and then write to them separately to see if they have any research or field opportunities. I think it can be a great idea to join a study abroad for the summer, if that's possible. Definitely do something. It all broadens you.
I'm going to give you another consideration. We have a program at U of L that it's not novel, particularly at our program, but we're happy to replicate and extend quality practices of a learn and earn model. Students that come to our program for MSHA in person for the evening track program, classes start at 5 o'clock in the afternoon with intentionality. We have a program with the University of Louisville Health System. We're developing similar inroads with Baptist Health and Morton and Humana in downtown Louisville, where students work as administrative interns during the academic year. And so from 8 or 9 o'clock in the morning until usually 3 or 4 o'clock in the afternoon, on a part-time basis, at least 20 hours of paid employment, to as many as 30 or 32 hours. Students can work during the didactic phase of our MSHA program as administrative interns at one of the systems downtown. You earn income, it helps pay for the rent, groceries, et cetera, diminish debt. But yet what you're actually doing is simultaneously integrating knowledge that you're developing in the classroom in practice with one of the health systems or health organizations there in the local area. So that learn and earn model, it's good and useful at U of L, but it also provides a basis to have that learning experience and have a good sense of the way forward. Could very well be that you find that because healthcare management, health administration is so broad in terms of organizational perspectives, that you may find that you're not interested in working in a hospital, but health insurance or group practice, working for an orthopedic surgeon group or primary care might be more interesting to you, as you have a chance to conduct rounds within a system to have a richer and broader experience.
To add on to that, all of our graduate programs, especially the master's program, the classes are held in the afternoon, late afternoon as well. So that way, if you're a professional, if you have a job somewhere, you can do that and balance. Plus, we offer all our programs both in full-time and part-time mode, so you can switch between those as well. And our MPH program has a practice experience requirement, so that also gives you practice component during your 3 semesters.
Thank you all so much. That definitely helps. Thank you.
Well,
Anything else?
Well, we have about 4 or 5 minutes left. I appreciate your time. We are building and growing our programs at University of Louisville. In fact, in about 4 or 5 minutes, I'm on a faculty call. We're recruiting more teammates. So we're a national recruit to bring in more faculty to grow our programs. We're looking for talent. And so that's part of the consideration. You all are going to be center grads soon, and you have a very valuable level of development, one of the finest institutions. If you or any of your classmates are interested in joining our team at U of L, that'd be great. We would appreciate it. But you're going to have choices. And as a homegrown Kentuckian that went out of state for most of my higher education, I appreciate those choices. but also be mindful of what choices you have here within the local area. So it's good to spend time with you all.
Yeah, agree.
Thank you, Lee, Ann, and Deepti so much for today. We really appreciate it.
Sure.
You're welcome, and thank you so much for giving us the time today. Lastly, I'm sharing our contact details. If you have any questions or anything, you can reach out to me or on the email mentioned here. And we'll try to share a presentation with Bryna, which if you have any questions or admissions, you can follow up on that too. So thank you again.
Yeah, and let us, and I think Lee